Ooh, the way that sun is shining on my face, on my skin, my skin, my skin. Hey y'all, welcome back to Madeittomedicine with Vicks. This is day 2 of reproductive health. It is an elective for my 4th year of medical school. I'm like 5 months away from being done. Anyway, I'm running out of the house to get to a procedure clinic. I'll be working with the program director in this department today. And yeah, so I need to find my glasses so I can leave. But I did review some of the cases, but I need to honestly leave now so that I can arrive like 20 minutes-ish early to have more time to acclimate. And yesterday I literally went to the restroom like once and I didn't drink water at all, but a sip from the water fountain, and I'm anti-water fountains. So let me go and gather my bearings, and at least today I can actually log onto the computer, so that is something. Make sure y'all put y'all SPF on, because the way the sun is shining, yes, I look great, but I just put that sunscreen on to protect that skin. All right, see y'all in a little bit. All right, so day 2 was, I'd say, pretty good. I had morning clinic and then afternoon clinic. Afternoon clinic was a little bit much, but at the end, the attending straight was like, look, if we cross paths again, I'm like, we will. And they're just like, I'm willing to help you with applications. I'm willing to like help out in any kind of way. And I know today was a little wonky, but next time, like, be sure to ask them if you can place the speculum. And I'm just like, yeah, under normal circumstances, I would have, but like, you know, these patients, I wasn't gonna put them through that. It already was seeming like a bit of a traumatic event. So all in all, I'd like to say it was a good day. And I'm on my way home now for a repro event online on IUD insertion. So I was just like, hey, is it cool? Because we were done with patients, like if I head out, because I have this repro event, and I mean, I'm on a repro health elective. So, you know, letting them know, you know, hey, I'm not new to this, I'm true to this. And they're like, yeah, that's cool, that's fine. So yeah, Wednesday mornings, we have the morning off, and then there's teaching in the afternoon. So tomorrow morning, I'm about to be studying something. Like, I ain't been getting enough sleep, so I'm like mad tired. But I'm gonna study tomorrow morning, and then gotta come up here for didactics in the afternoon. I found out that it's with the attendings and the residents, so that should be cool. I do some studying for the rotation and for step 2. But yeah, today has been a great day. Go home, log on to this event, and I low-key want to be sleeping at 9 o'clock, but that's not gonna happen. I have not been working out, so I need to do that, okay? We're gonna go to the gym today. We're gonna get our lives together. 3rd time is the charm, as I literally entered and exited my unit a smooth 3 times. First, I thought I left the TV on. Then I went, okay, I locked it, then I unlocked it. Then I was like, oh, maybe I left the TV on. Then I didn't even make it to the stairs, and I was like, oh, I left my sweater. And as I go back in to get my sweater, I realized, oh, I left my lunch. Girl, it is together. And I've been up for over 2 hours because I'm supposed to get tutored at 6 o'clock in the morning, but I did not today. So now we head out to arrive about 20 minutes early. Let us go. Good morning, y'all. It is Monday, and I'm the first one in the clinic today. I arrived 30 minutes early, but I'm gonna tell y'all more about this later because I'll be feeling weird recording while I'm here. But just know I am currently pre-charting, looking at all of my patients' charts to know the proper questions to ask them and to have good patient presentations to my attending. But stand by. I have another clinic after this. I think it's an endocrinology clinic. So happy Monday.
I'm so hungry and I ate breakfast. This don't make no sense at all.
Finally heading home from clinic. I ain't even checked the dang on bus schedule, no nothing. But it is almost 6 o'clock and this is the latest I have stayed to date. I'm actually kind of tired and likely need to eat some food, seeing that I had a PB&J for lunch. Oh, dang, is that my bus? No, it's not. Because the way I was about to put that pep in that step, y'all, and get to running. All right, let me check the schedule, though, because I want to get home. Okay, so today I was in procedure clinic for the beginning and like the AM and PM clinic, but I was with 2 different attendings. But let me go back. Recap over the first week. It was amazing. Like, I love everything reproductive health. I didn't realize that this is something that I was passionate about until I started my 3rd year, which is why a lot of people will say, like, come in with an open mind because you never really know. And I also think there's this misconception that reproductive health is only obstetrics and gynecology. It is not. If you think about it, if you have reproductive organs, any physician that you're seeing as your primary doctor is reproductive, right? Like, if you see a urologist all the time and that's your primary physician because you have urological issues, like urinary incontinence, or what's something else urology does? Oh, they can also do if you constantly having like UTIs or pyelonephritis, which is inflammation of the kidneys. Yeah, right. So that's can be some primary, or I'm trying to think, y'all. Of course, when I just put myself on the spot, I can't even figure it out. But like gender affirming care could be through urology, and that will be, it could be considered as reproductive as well. Obviously obstetrics, because that's OB patients. If you're being a pediatrician, you're seeing adolescents going through puberty and doing birth control, management, care, even just talking about the changes of puberty, that's also reproductive. So I have gotten to do so much in addition to the colposcopies. I've also talked to patients about medical abortions, some IUD placements, which is an intrauterine device for birth control. I've done birth control counseling myself, where I had to actually, on my first day, a resident was so kind to go through the CDC method where they show you, here are the side effects, here are the risk factors for people in different tiers. So if you have like, are at risk for blood clots, you can't get an OCP, so an oral contraceptive, you cannot use the pill because that can increase bleeding risk, right? So there's just so many different things I've done so far. And of note, today I was looking up, how did they put it? Because I was like, I have to write 2 papers. And I should have emailed myself the paper that I found on PubMed, but of course I didn't. But it's basically people who were unaware that they were pregnant and they had a baby. So I was reading an article on that. And I'm also interested in maybe doing like different treatment methods for cervical cancer screening. And for those who have come back with an HB positive, what does the screening measures look like? Because technically you'd have to do a colposcopy every year until the grade of cervical cancer decreases from like a stage 3 or 2 or 2 or 3 down to a stage 1. But they do colposcopies, but also like, is cryotherapy effective enough so that you don't have to do a colposcopy, which is taking like a small little bitty piece of the cervix to biopsy and send it to a pathology for them to say, okay, it's still cancerous, it's not. But can you do cryotherapy, which is essentially like freezing the cervix a little bit, like in layman's terms. Other things, some, in addition to prenatal visits, like newborn wellness, I've done HIV PrEP treatment, or PrEP treatment for those. I'm not sure I've actually seen an HIV positive patient on this rotation to date. And then some other things, because since it is just procedure clinic, cutting off skin tags, doing shave biopsies, knee injections. I love so much the autonomy that I get. There's a difference between when there's a resident working with us and it's just me as the student. If it's a resident, they have numbers that they need to get for procedures before they can graduate. So I kind of like get bumped down the line, so I don't get to do it as much, but I have been a little bit more assertive. Like if we're doing a colposcopy, I'm like, hey, can I insert the speculum? If we're also doing a pap smear with the colposcopy, can I do the pap smear and then you do the IUD insertion, or then you do the colposcopy, right? Because I would like to also gain some experience in these things. Love that. Don't love when I have to come home and write notes from clinic, or don't love when we're running so behind on clinic that I forget to use the restroom or I forget to drink water, which is also really not good. This morning I got really hungry and I was shocked because like, bro, you eat breakfast every morning. And so I'm assuming I might need to, I didn't have the protein smoothie this morning. That's exactly what it was. I had a boiled egg, 2 pieces of bacon, and 2 pancakes. So I was like, what's really good? But that's exactly what it was. I didn't have my protein smoothie. That would have been a cherry on top. My notes for the most part are good. I did get some feedback today that I need to be a little bit more organized with my presentation because I kind of like mixed up some subjective and objective things. But last week on feedback, it was like, oh, you were very efficient. You kept up with the pace of clinic, the flow and everything. You were really good with Epic and asking the patients all the things. And even when I had more complex patients, it was fine. Like the physician didn't really have to add much. It even told me like, oh, I looked at your notes and they were great. I didn't have to add anything. And if I need to fix anything, I'll Epic message you later. And I never got an Epic message, so shout out to that. I've also been in an endocrinology clinic, so looking at patients who have osteoporosis, and a risk factor is early onset menopause. So typically people go into menopause around like 50, but if you go in like your early 40s, now you're losing estrogen, and decreased estrogen can be a risk factor for osteoporosis and also a risk factor for increased cancer risk. So endocrine clinic was kind of hard because it's different. I've never been in a specialty clinic like that before, but it was pretty cool. Only had 2 notes to write. Maybe it was 3. Those notes were long though, because you do a DEXA scan to check for bone density. And yeah, and there are like some different medications you could be on to try to like slow down the bone breakdown. And what we really want is some like bone building blockers, so osteoblast instead of class, which is crash. All in all, that was great. I'm gonna have to cut this short because I'm really hungry, and that's probably why I'm talking so fast. I didn't even sit down to talk to you. I'm literally standing up right outside my kitchen because I want to eat. But tomorrow in Didactics we have newborn something, so hopefully it's like a hands-on thingy bob, and they feed us. So I love that for me. Catch y'all next time. On Wednesdays, we wear pink. Y'all see my shirt? Okay, period, because that's what we do. So I'm on my way to the train from Didactics, which was amazing. Y'all know how much I love my breastfeeding medicine rotation, and I feel like that's my train. It might be, and I think it is. Yep, it is. Well, I'll be waiting for the next train to come. So y'all know how much I love my breastfeeding medicine rotation, and so today for Didactics, as I'm on my reproductive health rotation, we had 3 different breakout sessions. And so it was one on like feeding for breastfeeding and bottle feeding. How do you clean the materials? So basically, you need to clean it after every single feed. And that's for breast pumps and bottles. So for bottles, you can really just like swish it around with the water. You don't necessarily want to use like a dish rag or something, because those things low-key be having germs and bacteria on it that our microbiome and our guts can handle. But babies, they, especially in the newborn phase, they are immunocompromised. They ain't got no immune system, okay? And so you just want to keep them as safe as possible. And once it has dried, you don't want it to sit out, because then the dust and stuff from the air can hit it. And so I was like, okay, so where do you like put it? And they were like, just put it up in the cabinet. I was like, oh, okay, just out of there. Cool. So that was nice. Breast pumps, you can put them in the dishwasher, but kind of not really necessary to do. And then the next session or next group was circumcisions. And this is something that I learned because in class, like my first 2 years, they were like, oh, the indications for getting a circumcision, which is removing the extra foreskin from the penis, is to decrease the risk of UTIs, urinary tract infections, and decrease the risk for penile cancer. When I was talking to my friend the other day, she was like, that data is not from the US, it's more so from underdeveloped countries that maybe not have as many like cleaning supplies or clean water, things of that nature. So the only indication for a circumcision is cosmetics. And then let me see, what else was it? Hey. Let me see, what else? Oh, the last one was on car seats and the use for car seats, the indications, and yeah, you can borrow car seats from someone else or like get one from someone else, but just know that there's a expiration date on it, and they typically, if I could get my umbrella down, they typically expire after 7 years, but there are some programs that allow you to submit your, your car seat and get another one for free. So yeah, all in all, I really enjoyed it. Y'all know I be loving all the things. I love a good workshop when I'm not on my phone because I'm really like engaged and invested. Okay, it's giving life. It's giving. Now I'm about to go home. We got out early, about like an hour and a half. I'm gonna go finish studying before I tutor and then go swimming tonight.